Okay, ready? Welcome, everybody. Welcome back to week 5 of a 10-week series that we're hosting at the Owen R. Wilson Center in Galax, Virginia. This week, we have my twin sister joining us as a guest speaker. And this week, we're going to be talking about proper exercise routines and just like physical activity and what that looks like if you're suffering from chronic pain or illness and still being able to be physically active. And later on, we'll talk about a home exercise program and kind of different strategies to be able to implement proper exercise and physical activity into your daily lives. So, whoops. So this is my twin. This is Emmy. She's joining us. Emmy, would you like to go ahead and introduce yourself?
Yeah, hey guys. So yes, my name is Emmy. And I have completed my Bachelor's of Science in Kinesiology at Anderson University. That is where Ellie and I both went to school and we loved it there. And because I love my time there so much, I actually chose to stay and complete my doctorate of physical therapy there as well. Um, and I was a part of a newer program there. So I was actually in their second graduating cohort and I just absolutely loved it. But after school, I moved to Columbia, South Carolina, where I now work at Carolina Physical Therapy and Sports Medicine. We have a few different clinics all over South Carolina, and I just absolutely love it. I would say my favorite part of my job is definitely the relationship building I have, and just building relationships with my patients while I help them through their journey through PT. It's not necessarily the easiest thing. So, helping them gain a healthier and happier version of themselves is definitely my favorite part. Also, I will say I love nothing more than hearing how independent and happy my patients become throughout their time. And I would say probably my favorite population is definitely my neuro people. I would say my absolute favorites though are my elderly men with Parkinson's. They are definitely my favorite people to hang out with. So I would say I thrive in all settings of PT, but that one has to be my favorite.
I love that. Yeah, so Emmy's joining us this week to just kind of talk to us and give us some really good tools for being able to stay physically active at home, but also preventing further injuries and preventing chronic pain and being able to manage that and kind of strengthening our bodies and being able to, as we grow and as we age, just continuing to be able to live our lives to the fullest. And so we'll continue to talk about that. But first, on Tuesday, we had an opening discussion where we just kind of talked about physical activity in general. We talked about some of the barriers to participating in working out and just getting to the gym or even getting outside, getting to a brisk walk. Sometimes it's not just life that gets in the way, but it can be physical barriers. And so we talked about some of those. And some of our participants shared what their physical barriers are. We talked about what their current physical activity level or levels look like and what they do to participate in activity. We talked about, if you do have chronic pain, what does that look like? How does it impede on your physical activity? Are there times of the day that you're still able to participate? Where is that pain located? And we kind of talked about and broke down pain further throughout the presentation, which you will see. But then we talked about what's the most important thing that you would like to walk away with today, like regarding pain education, regarding being able to participate in physical activity. And some of our participants said, just a place to start. I think it can be really overwhelming knowing that there is an end goal in mind, but knowing where to start can be so freeing and reassuring. And so that's kind of why I brought Emmy along in this week and just kind of to get us started in the right direction. Um, and so first we want to understand chronic pain. We know that chronic pain it can show up in various areas in our body, but overall that pain it usually lasts or it comes and goes for about 3 months or more. Chronic pain can honestly occur anywhere in the body. Um, Chronic pain doesn't just come from having an injury and that injury not being completely resolved. Chronic pain can come from just overall joint weakness, muscle weakness, as well as other chronic illnesses that can, um, I guess, pain being one of the barriers to those illnesses. So if you think of cancer, there's a lot of pain that can come with cancer as, as soon as you start chemo and those kinds of things, there can be secondary pain, but becomes chronic pain. And so when you really break it down, pain interferes with your everyday life, interferes with your work ability, your ability to be able to participate and hang out with others and socialize, and ultimately taking care of yourself and the things that you have to get done every day. Pain can cause depression and anxiety. It 100% can disrupt your sleep. That's why we talk about positioning and sleep hygiene, how important it is to prepare our bodies for sleep so that if we are in pain, we're still able to get that, the designated hours of sleep that we're supposed to get every night. And chronic pain overall can just feel like a vicious, never-ending cycle if you don't, get a good grasp on being able to manage it. And so we talked about chronic versus acute pain. And similarly to what I mentioned, just in the past slide, chronic pain can continue after a long recovery from an acute injury or illness that's not quite healed yet all the way, or it's healed, but you still have pain, or there's been complications from those injuries or illnesses. And chronic pain can happen for no reason. We think about um, different kinds of ways that this can present, but sometimes I just think about like a chronic pain I would associate with arthritis. Arthritis would be a chronic pain in my brain. Just that never-ending pain, that kind of numbness, tingling, um, sometimes throbbing pain that can be in your hands and your legs and honestly in all joints of your body. But acute pain is different in the sense that it doesn't last long. It doesn't come and go. It usually is a result from an injury where your body has been under severe trauma and it's trying to heal. And so that would be an acute phase of pain that you would be experiencing, like a cut, scrape, bruise, broken bone. It could be worse from there, but this I used as a tool to just kind of separate the two and really break down chronic versus acute because we can experience both, but not necessarily at the same time. Locations of pain, we spoke about this briefly on Tuesday as well. It's scientifically proven that chronic pain is a prevalent medical condition, and it's honestly one of the primary motivators for seeking medical attention and why individuals go to primary care and seek help. It affects approximately 25% of adults, which might not sound like a lot, but in the grand scheme of things, that's a decent amount of people. And it looks different for everybody, right? Chronic pain can be in different locations based on who you are, what your history is, right? Like how hard were you on your body in your early years, that kind of thing. Common types, like we talked about, arthritis or just general joint pain, which you can experience as we age. Back pain, neck pain, like we talked about, cancer. This pain can also occur near a tumor, not just post chemo and things like that, the other complications that can come with cancer. Headaches, including migraines, that is 100% considered chronic pain. Definitely a pain that I would consider comes and goes and maybe not always consistent. Testicular pain, this for our males is actually called, and I'm really bad, Amy, if you want to try to pronounce this, you can, but I think we both tried and it was like orchiliga, something like that.
Orchialgia? That's my best guess.
Orchialga. That's a great guess. We're gonna go with that. Orchialga. Lasting pain. And if you've ever experienced an injury where you required surgery, or some sort of injury that resulted in a scar, you may have some tenderness, some pain around the scar tissue. And then muscle pain all over, such as fibromyalgia, neurogenic pain. And this is actually a pain that's caused from your nerves or other parts of the nervous system. Now we're going to talk about identifying chronic pain. This was an activity that we did on Tuesday. We just kind of worked through this worksheet. So this is typical this might be kind of like a worksheet you would fill out, or you would have maybe somebody like Emmy, a PT, help you fill out when you're trying to identify pain, assess the levels of pain and what those symptoms are, how they're impeding on your daily activities. Like, what is this, and what is this preventing me from being able to do? This would kind of be a similar form to that. And so we just kind of worked through this worksheet, and at the top, there's just different types of pain that we talked about. And then the scales of our physical symptoms and our mental, cognitive, and emotional symptoms. And then for exacerbated conditions, there's a little section down there, and then to write notes. But this was just a good resource that I put out there. Um, if this is something that you do struggle with every day, and like your pain changes, like it's, sometimes it's a stabbing pain or sometimes it's a throbbing pain, it can be really good to record these things and just keep track of your pain. If there's certain activities that you've done during the day to aggravate that pain or to make it worse, write those things down. It's important to know so that you can you have control over those things, so you can change them, right? You can change those kind of lifestyle factors in order to maintain this pain a little bit easier. So we just kind of discussed that on Tuesday. Um, and another thing we talked about were just some common causes and risk factors for chronic pain. There isn't always an obvious cause for this chronic pain, like I discussed briefly in a couple slides prior, but some of the ways that we see ongoing pain would be in conditions like arthritis, migraines, a chronic illness like cancer, like we discussed, and injuries that cause pain to your body. So if you have an injury that doesn't heal quite properly or all the way, there can still be a lot of like sensitivity to that. I gave an example for me. I'm not necessarily in chronic pain. However, I broke my collarbone when I was in the 5th grade, and it was a very, very painful injury. Amy probably remembers when I was in like this huge immobilizer and that kind of thing. But um, it really left me, and I'm still sensitive to this day on my collarbone in that area where I broke that bone. So this can happen with a sprain, a broken bone, like I said, even an infection. Your body can just be more sensitive to those areas that you experience pain or injury to. And then we can have something called psychogenic or psychosomatic pain. And this is actually chronic pain that's not tied to your body physically, but it's actually more psychological. So this can be tied to stress, anxiety, depression, but this pain could be referred out to your body, and you could potentially feel it physically, like migraines, for example. When we're really stressed, we get migraines or we get stomach aches. This is definitely something that I struggle with, and I've definitely had trouble with and tried to manage. But once you and we've talked about this in previous weeks, but once we can kind of get a hold on our stress and our anxiety and manage those things, that pain seems to kind of dwindle, right? The migraines go away, the stomach aches aren't as frequent. Um, but it's believed to come from a low endorphin levels in your blood. And so endorphins are actually, they're natural chemicals in our body and in our brain that make us feel good or happy, elated, make us feel more positive. And so if you have low levels of that in your blood, that can also be a cause of this psychogenic or psychosomatic pain. And then causes of pain can also overlap. So you could have a migraine, and then you could have a psychogenic pain. I feel like a migraine might not be a great example, but you could have a sprain, right? And then you could have a psychogenic pain, which would be, or psychosomatic, which would be the migraine. So you could have a migraine and a sprained ankle on top of that because you're stressed that this was a career-ending injury or something like that. And there's a lot of stress from that because, this is what you were supposed to do for the rest of your life or whatever it might be. You can experience different types of pain at the same time. So occupational impact in managing pain. And when we look at this, we really want to see the impact of pain like on our daily life. So once we manage it, what's going to be easier? What are we going to be able to do that's not as hard right now because my pain is so crippling? And so there's these 4 kind of areas that we look at, which are actually called the 4 pillars of stress management, I believe. We'll go over them in a second. It might be on another slide, but these are kind of the four pillars. And these are lifestyle changes that are associated with chronic pain, but we have control over. And so if we assess these, and we look at them and we, use these tools and these strategies to improve them, we will find that our chronic pain will also improve. And stress, exercise, diet, and sleep are all affected by chronic pain. Um, Stress in particular can play a major role, um, and that you want to reduce your stress as much as possible because this can help reduce your pain. So you can do this through meditation, some mindfulness activities, deep breathing, some body scanning type activities. I would honestly really recommend body scanning activities because it can help take the attention off of that really painful area and bring awareness to all parts of your body. And so that can also help relieve pain. Exercise, so just participating in low intensity exercises, getting your heart rate over 100 beats per minute for at least 20 to 30 minutes a week, for 5 times a week. I would say five's like the gold standard. Maybe if you're starting out and you're like, this is all new for you and you really are just trying to get back out there, maybe set a smaller goal for 3. Like a more obtainable goal would be 3 times a week. But definitely stick to the 20 to 30 minutes because I think that is 100% obtainable. But you can always work your way up to 2 more days in the week. So you can start with walking. I emphasize to our friends on Tuesday that a light swim is really good for you. Getting into a water aerobics class, cycling. She does have some pain, some chronic pain that's been a result of a pretty traumatic injury that she had a couple years ago. And she has a lot of referred pain from that. And so suggesting other ways that aren't weight bearing activities. So getting her in the pool. Yes, cycling is weight bearing, but to the fact that like she's not standing on her ankle the whole time. She's able to move it. There's more mobility in her ankle, and that's kind of where her injury was. But exercise in general can just be a stress reliever. So I 100% just tell people exercise anyways, because that's the best thing you can do if you're stressed, if you're anxious, or if you're in pain. You can exercise and just keep moving. Because what do we say, Emmy? We say if you move it or lose it. So diet is definitely important too, kind of coincides with all of these things, but it's important to boost your overall health and well-being. We know that diet is directly tied to our bodies and food is medicine. I'm learning this kind of this week as we head into next week. Planning meals and budgeting meals, healthy meals on a budget. There's a lot of lifestyle factors that you can change that impact your diet. Um, Trying anti-inflammatory foods and eliminating the foods that do cause inflammation. So keeping a food log, which we've talked about, writing down the foods that bother you. Write down the ones like, oh, well, I had a great day. Like this is what I ate. Don't be shy of what you ate. Write everything down, because it's a good way to track and see. And then if you need to cut things out of your diet, we have a log of what we eat, so we can go ahead and start kind of hacking away at that. But red meat and refined carbohydrates are some of those anti-inflammatory foods that you could try. Sleep. So getting an adequate amount of sleep is definitely important for your overall stress and management, but I feel like for your overall body function as well. Our bodies need sleep. We need at least 8 hours a night. Try if you're going to nap, if you are a napper, try really hard to limit your naps for no more than 20 minutes. I mean, I have a friend, literally the only person in the whole entire world I know that could actually nap for 20 minutes and not go over, not go under, which I think is a talent to master. So if you can, really try, but if you go over a little, it's okay. Lack of sleep can definitely cause weight. So can cause weight gain. So if you're having a hard time maintaining weight or keeping weight down, take a look at your sleep schedule, your sleep hygiene, what's keeping you up, how many times do you wake up? Why are you waking up? Are you in pain? Do you have to go to the bathroom? That kind of thing, because a lack of pain can also make your pain, or I'm sorry, a lack of sleep can also make your pain worse. And with sleep, we'll also talk about positioning and those kinds of things, because I definitely think there's a way to manage pain with positioning, especially when we're trying to sleep. So research says when it comes to managing chronic pain that we definitely need to participate in movement and exercise. Emmy will tell you this. She is the research. She is one of the resources of research, but she will 100% tell you to keep participating and moving and exercising. I would say participate in activities that are meaningful to you, the ones that you feel the most, the most of your time with. Don't, if you've never knitted, like, not that that's a physical activity, but if you've never knitted, don't pick up knitting. You can always try it, but as far as like physical activity, do things that you know you like, and then you can branch out from there. But if you're just getting started, stick with a couple things you like or know you like. Another thing you can do that research says is modify your environment. So, whether that's social, cultural, institutional, you can control that environment. So being able to, um, like kind of what we talked about in a couple of slides earlier is that, you know, stress, chronic pain, that kind of thing can impede on your ability to socialize. And so if you modify that environment so that you can participate in those occupations and you can participate in socializing, that can be very helpful in managing your pain. Become a part of a group. There's lots of groups, maybe within your community or outside of your community that you could be a part of. There's a sense of belonging in joining a group, having some accountability for exercising. Find a friend that you want to walk with every week, start a walking group, something like that. It can improve your mental health along with your chronic pain and just your overall physical activity. Self-management strategies, we've talked about sleep, but again, just establishing a routine, investing in your position, investing in your actual bedding and all of that. I find that, my bed's the place that I enjoy being at the end of my day. I want it to be a comfortable place. I want it to be enjoyable, a place that I can wind down. Try an exercise program. We'll talk about this. Emmy has a home exercise program kind of for us to get started as far as like prevention and strengthening. But this is helpful in something that you can do on your own time. And so being mindful of your body mechanics, how you are lifting weights, how you're bending, how you're squatting, your posture, overall in general, just your daily posture while we're driving, but while you're lifting weights and being safe while you're doing that and exercising. You can manage your stress, again, like I mentioned earlier, by mindfulness techniques, some imagery or visualization techniques. If you have the means, please get a massage. I highly recommend them. They're very, they're very relaxing, but any way that you find, you can relax and manage your stress, this would be one of the ways that you could manage that. Research also talks about activity pacing. And so being able to break up your activities into smaller portions. This kind of ties into energy conservation, but having in your environment, having a stool or a chair nearby to where you can take breaks, take rest breaks, whether you're physically hurting or you are just tired. If this is always just kind of a helpful thing to have, put a chair in your shower. There's no shame in having a bench or a shower. Or a seat in your shower. It's there for you because we work so hard in the shower. Showers can also be very unsafe areas. But if you are in pain and transferring in and out of a shower is hard at baseline, I would highly suggest getting a bench or a chair for you to transfer onto. It's safer and it will kind of provide you a way to, I guess, get off of your pain, relieve your pain during your shower. And really, that shower is a way for you. Also, it's kind of serving as a modality for you to use in your shower. It loses heat, and it might feel good on your joints or your muscles after you've been on them all day. So consider that. And when you plan your showers, and that kind of falls into task adaptation. So adapting your environment that's related to the task. So if you have knee pain, like chronic knee pain, getting dressed is really hard for you. Lay your clothes out the night before, bring them closer to where you get ready, be on the edge of your bed or a chair and have those clothes right there. Don't work harder, work smarter. Use adaptive equipment. Use a reacher. Use a shoehorn. Use a sock aid. All those things are there, and these resources are here for you to use to make things easier for you. Again, modify your schedule depending. Assess the activities you have to get done during the day. You can always change them around. So if you have more energy or you're in less pain at the beginning of your day, knock those things out. If pain's really hard for you at the end of your day, and you know that about yourself, plan your day around that. You can also change the quantity of your tasks. If the quality is like super high and you're spending a lot of time or it's highly engaging task, you can eliminate some of the quantity of those tasks that you have to get done during the day. So just planning and adapting your tasks around your pain. And then of course thermomodality. So again, in the shower, like I just said, you want something that loses heat. So like one of those old-fashioned hot water bottles, a hot moist towel. When Emmy and I were growing up, my dad used to pop one of the diapers in there. He'd get it, put a little water in the diaper and then pop it in the microwave and it'd steam his head for his headaches. And this was something that really worked for him. And of course, it loses heat. So something to consider. But this was a resource I handed out on Tuesday as well. It's just another pain diary, kind of a way to assess our pain, document our pain, and keep track of it. And this one is a little bit different in the sense that you can write your symptoms, you can circle and identify the areas in which you were having pain. You can rate that pain and then any other symptoms you were having because of that pain or due to that pain or in addition to that pain. And then of course, any other notes or things that you feel like are important to add to this diary. And then your mood, mental clarity, and energy levels for the day. So, Amy, is this one new? Yes, I think so.
Yes, this
And we
one.
only have 10 minutes. So we'll have to kind of hurry. So I'm sorry.
No, no worries. Okay, so I just wanted to kind of highlight a few things with why exercise and movement is important. And again, a lot of this is just coming from my PT brain. So bear with me on that. But just something to keep in mind, everyone has to start somewhere. It's hard, first of all, to even be motivated to get to this point. So all the things Elliot has said previously to now, please keep that in mind while we're talking through some of these things. You just have to start and you got to start somewhere. Nobody ever said it would be easy. And so keep that in mind and give yourselves grace for that. But we just talked a little bit about how our bodies were made for movement, like they truly crave it. And so think about if we stopped all movement and we never exercised our bodies would quickly, so quickly, there's a very specific number and percentage of how quickly your body loses muscle mass, and I don't have it right now in front of me, but it's super quick, you guys. So the quicker we lose all of that, our supportive functions start to go too. So think about your strength and your exercise. So it is very important to just keep moving. And so sometimes we can overdo it. So keep that in mind. So usually that's when we end up sore. But truly, this is a great sign because your muscles are growing and becoming stronger. And something I would encourage you to do is to just keep moving. Even when our muscles are sore or we don't feel like moving, it actually feels better after the fact to just keep moving, whether it's going for a walk instead of doing exercises. Like it truly helps your body feel better afterwards. And then a few fun things that we do say, Ellie already said one of them, move it or lose it. So I put a few other ones on here. Motion is lotion. All of my brothers and sisters that have arthritis, you guys know what I'm talking about. Motion is lotion. We just got to keep things moving. It'll feel much better. And then mobility equals motility. This was my favorite one to say to all my patients in my hospital rotations over a year ago, guys. Like every time we would get our patients up and moving, they would definitely have to use the restroom after that because they haven't been moving. And so once you get them up and moving, they're like, oh, gotta have a bowel movement, stuff like that. So moving your body helps other things throughout your body, like your bowels. They helps them keep moving and everything is kind of staying in sync. So Moving forward, um, some things that we get to use with our patients and some things we just try to start them out on is a home exercise program. We call it an HEP for short. Um, these are typically exercises. A lot of them are the ones we'll talk about today, but they're typically ones that we prescribe to patients to do on their own. And when we see them in the clinic, we're doing stuff completely different. So it's definitely a program designed to be done in conjunction with the therapy we're doing. And sometimes it can also be used as a maintenance program when you're done with therapy. So the good thing is, it definitely keeps you moving and you can always progress. So with the home exercise program, there's definitely ways to improve it and progress it, such as TheraBands, weights. You can increase your reps or sets, all the things. And then we also talked a little bit about safety and body mechanics. We did have a participant who was a caregiver. And so if you guys can think about how truly demanding that is on your body, especially if you have someone that you are caring for who's very dependent. You have to be very careful in how you protect your spine when you're moving somebody or something that's super heavy. So we talked a few things about lifting. You've probably heard these things, lifting with your legs, not your back. We mean that because we don't need any slip discs, okay? We don't need any disc protrusions happening, causing a lot of pain through your spine. But we also talked about bracing your core, and just keeping your core tight. We have things like that are it's called a Valsalva maneuver, and that is truly bracing your core before you go to lift anything. So we kind of talked a little bit about what that looked like and kind of walked through some of those things. But I was able to provide them with this home exercise program. Again, these are things just to keep moving. There are so many things I wanted to throw in here, but I couldn't because we would have been here forever. Um, so I just wanted to throw in a few things. We talked about some neck and shoulder things. You see this guy, he's using his TheraBand to get his rows and his extensions, just working different areas of the shoulder. We moved into some lower back and hip exercises, some movement, just again, getting some motion through that spine and then throwing in some exercises and stretches as well. A lot of these, again, you can see they're laying down. So I educated our participants with just doing some of these things before you get out of bed. A lot, I mean, especially if it's back pain or knee pain, you're not going to feel the best in the morning because you've been stiff the entire time you've been sleeping. You haven't been moving for maybe 7 to 8 hours. So again, keep that in mind. You can definitely do some of these things before you get up and moving for the day. So yeah, just a few different exercises for the legs there. And then here moving into the feet, we did have a participant who again had a pretty difficult time with her foot and her ankle there. So I was able to help her walk through a few of these and give her some in addition. Again, just keeping some range of motion through those joints, and you got some small muscles in your feet. So we needed to I showed her a few exercises on how to move her toes, and it's really important for your big toe, especially when you're walking. So we kind of walk through some of that for her specifically. But yeah, I try to throw in a little bit of everything just for each body part. Again, like I said, I would love to have just spent a whole hour talking about this because it would be so much fun. But we had a good time.
Yeah, it was good. And I was able to just hand them this kind of daily fitness and activity tracker. So if they are this was one I listed another one here too after this. This one is more for if they perform those home exercise programs, just keeping track of the exercises that they did, how many reps, how many sets. And then this one would be just kind of an overall fitness tracker, activity tracker. So it's identifying your weight, your food intake, what you had that day, your sleep quality. It kind of is an all-encompassing tracker, which is really great. And so I gave these resources for them to kind of utilize. And then we just had a Q&A with Emmy, and it was awesome. We just kind of talked more about those exercises. We discovered some more kind of areas that we could provide resources for the participants. Some of them needed some more hip and knee exercises, because they discovered that that's like the hardest it's really hard to get off the floor. And those are the, the joints that seem to be in the most pain when that's happening. And so just identifying more personal barriers and some more personal strategies. We kind of did that in this time. And yeah, so really that's it. Emmy, you've been great. Thank you so much.
Thank you.
These are just you're the best. Thanks. These are just kind of like some reminders for the next coming weeks. This week or this coming week, we have our budgeting and managing money while trying to eat healthy. So we'll talk about that and dive into that this week. And then we'll have our check-in for our SMART goals that we established in the second week. And we will continue on through our last few weeks of that. And then as always, feel free to sign up, come join us on Tuesday or Thursday. We have from 6 to 7:30 on Tuesdays or 3 to 4:30 on Thursdays. And you can just scan that QR code and we meet in the conference center in the back of the health center. And if you're like groups are not for me, you can join me individually on a Calendly link, and this QR code will take you directly to that, or I have attached it right here. So you guys are awesome. Thank you so much for joining. Emmy, you're the best, and these are our resources.
Thank you,
So
guys.
thanks. Bye.
Bye.
Gotta leave.